Deborah Douglas found a lump in her breast. She felt lucky to be under the care of renowned surgeon Ian Paterson.
Over the next 8 years, Deborah endured a mastectomy, reconstructive surgery and chemotherapy, only to learn her condition had been exaggerated and her treatment was unnecessary.
She wasn't alone, though. In 2017, Paterson was sentenced to 20 years in jail after being convicted of harming multiple women and deceiving over 1,000 patients.
As Deborah shares her shocking story in a new book, The Cost of Trust, she joins us now. Good morning, Deborah.
Good morning.
Thank you so much for coming and having a chat to us this morning. So you first met Ian in 2003.
Yes.
What was the situation? Describe your first meeting.
I met him because I'd found a lump in my breast and I saw my GP. I had healthcare cover with work. So she said, if you've got private cover, use it. And I saw Paterson in a private hospital. And the first time I walked into that hospital, from the receptionist to the cleaner, everyone said, you're so lucky to have Ian Paterson. He's the best consultant in the country. He's one of the best breast surgeons. You've got the breast team. So I felt really confident when I walked in to see him. And that's how I presented, with a lump in the breast.
And obviously, as a woman, you must have been terrified. You wanted to be around for your children. Your father and your mother had both died of cancer.
Yeah.
So you must have been so vulnerable and so frightened at that moment in time. So to hear this must have been really reassuring, almost.
I mean, that's the thing. You're most vulnerable you could ever be. You know, you're presented with cancer. And as you say, after losing both parents to cancer, I totally trusted him. And I felt that he would look after me. He presented as this professional persona. You know, he had everyone there saying how good he was. And I had no doubt that I could trust him. And as I say, I felt compelled then to write The Cost of Trust because of that. It was the fact that I didn't know at the time that he was going to then harm me. I just totally trusted him.
He subjected you to some really painful surgeries. What did he insist that you needed to have done to treat this lump?
So I had a less than 2 centimetre lump. The first thing he did on that day when I met him was take me through to a room. He left my husband in another room and he took out a large needle without any guidance. He jabbed it into my breast. He said to take some samples from the lump, and it felt like a red-hot poker was being stabbed into my breast. And he said, come back.
He didn't anaesthetise or do anything?
No anaesthetic. It literally, he said, this is where you're allowed to swear. And he jabbed it into my breast. I could see the nurse looking perturbed. She was new to the unit. I started to cry because, not just because of the pain, but because everything came back to me, you know, my mum and dad dying and this diagnosis of cancer potentially over me. So, you know, it was a traumatic time. And he went out the room and said to Bob, oh, she's been very brave. She's been a good girl, very brave. And I was like, you know, when you look back on all of that and you think, at that time, I thought, this is him doing his job. And then within a few days, I'm coming back into his consultancy room.
Yeah.
And then he's telling me, before I've even sat down virtually, oh, sorry if I misled you about the lump, but your breast has got to come off. You'll go in with 2 boobs and you'll come out with 2 boobs and a nice flat stomach. And that's how he presented it. And I just said, well, am I curable? And he said, absolutely, you're curable. And all I thought was, I need to just do whatever he says. I've got 3 kids. I had to break the news to my kids and I'll be OK. So in my eyes, it was, I'll do whatever he said. He presented as knowing what he was doing. And his nurse was sat next to him. You know, and I talk about that in the book, their relationship and what happened, and the fact that, you know, there was this thing about she empowering him to sort of talk to breast cancer patients. And then I went down the route of having this horrendous surgery. So, I mean, that entailed removing my breast, my left breast. He talked about this immediate reconstructive surgery, and that meant they would take part of my stomach muscle, reroute it through my chest wall. He removed all of my lymph nodes, so I was cut from hip to hip. I had an elliptical scar around my breast, a long scar under my left armpit, where he removed all my lymph nodes. And then, as you'll see in the book, how it unfolds, years down the line, I found out all of that was unnecessary. You know, 7 months of chemo was totally unnecessary.
7 months of chemo
Yep.
on top.
On top of that, shortly after having major surgery. And all the things, you know, I'd seen my mum sadly pass away in quite a horrific way, you know. She was losing oxygen, she was on her life support, and I'm in that situation where I'm hooked up. I've got 6 tubes, drainage tubes, I've got an oxygen mask, morphine drip, catheter, epidural in my back, and I'm waking up watching a monitor where every time I breathe out, my breathing goes down, and when I breathe in, it comes back up. So I kept saying to the nurse, am I dying? You know, I thought same thing was happening to me. So it was an horrendous, you know, operation and procedure, and he put me through that really for monetary gain. I mean, that was the most expensive procedure I could have had. And
the insurance was paying?
The insurance paid, no questions asked. And while that was going on, he put me through a number of scans, unnecessary scans. PET scans are quite, you know, damaging. You get injected with radioactive dye and
but
all of
chemo
that.
too. What did you actually need? What did you need when you finally realised?
So years down the line, what I actually needed was just a lumpectomy. It was a less than 2 centimetre lump, no spread to my lymph nodes, grade 1. And there was so much for me to unpick. And as I say, I go through that in the book where I'm learning different things when I start asking questions, but not till he's suspended.
So, Deborah, you had this surgery. Eventually you recovered and you were getting on with your life, but then it was 2010, you read a newspaper report, didn't you?
Yes, yeah.
And what did you discover?
It was something that I didn't quite understand at the time. It said he'd been carrying out unapproved operations on around 60 women, and that they tagged these operations a cleavage-sparing mastectomy. Now, by that, they mean there's no such operation, first of all. It doesn't exist. It's not an operation that exists anywhere. But what it meant was he was leaving breast tissue where he shouldn't have been. So a mastectomy is, by definition, is a flat chest wall. Yeah. What he was doing was leaving these bumps in the middle where he said, oh, you're going to wake up and you'll have a nice cleavage. Now, in my case, I was getting immediate reconstruction, so they were putting the flesh back in. However, I found out much later that he probably left about 40% breast tissue. And also, when you start looking at it logically, if you've got cancer and it's breast cancer, all that breast tissue needs to be removed. And he wasn't doing that. He was leaving breast tissue in women that should have had a flat chest wall. And, you know, having this misogynistic attitude of saying, you look good in a bikini or you look good in a low top.
Yeah, I don't understand. And that's what I'm trying to kind of get a grip on is obviously he's doing it for the money, but there seems to be another element to this as well.
Yeah. You know, nobody just does something like that for the money, I don't think. And it's this, the fact that, you know, I watched him in court, and I talk about that in the book, The Cost of Trust, where he's basically holding the door open for me because he thinks I'll be happy with him to let me through, and he thinks he can do me a favour because he doesn't see me as somebody he's harmed, or he doesn't see me as somebody that he needs to worry about. But, you know, that was kind of pivotal for me when I saw him in court. As I say, there was no contrition. He wasn't sorry. So it's this whole element where I actually fought for inquiry, and the Bishop James inquiry, and Bishop James said that he groomed all these women in the community.
Deborah.
Yeah.
I mean, he was jailed for 20 years. I think there is ongoing inquest of 65 still ongoing. Lots of people fighting for justice. You have been compensated, and some of the other women who have been affected by you. You've written this extraordinary book which tells the tale, which I imagine was very cathartic for you to do as well. And thank you for coming in and sharing your story. We have reached out to a few people regarding this. A spokesperson from Spire Healthcare said Spire Healthcare has radically changed since 2011 when Ian Paterson last practiced. We've overhauled our leadership, culture and clinical governance to ensure patient safety is at the heart of everything we do. We welcome the independent inquiry's recommendations and have acted on all the recommendations relevant to us. And then a spokesperson for the University Hospitals Birmingham NHS Foundation Trust said our thoughts remain with the patients and the families who suffered due to the horrendous treatment they experienced from Ian Paterson. We will continue to fully support those affected and assist with HM Coroner's investigations. What's life like for you now, though, Deborah?
I mean, I'm still as busy as ever, probably more so, because, you know, I wanted to write the Cost of Trust because it was so cathartic to do, as you say, and people don't understand what the procedures are and the processes are. You know, they don't understand that if you go into a private hospital, the consultant still rents a room. You're not covered. If there's a criminal act, you won't get any compensation. So it's, for me, it's about ensuring the recommendations that came from the inquiry are in place and that we're acting on them, and that this doesn't happen again.
No.
Yes.
That's what we all want. Thank you, Deborah, for coming in this morning.
Thank you so much. Thank you.
Thanks for
Nice
the
to
book.
meet you.
Thank you.